My name is Randy Bigley. Joining me on the podcast right now from Ohio Eye Associates, Dr. Sarah Nye Brunner. Good morning.
Good morning. How are you today?
I'm doing great. Enjoying that fall weather out there.
Oh, no, summer. I'm a summer girl.
I am too. I don't like it either. I'm not a fan at all.
But my family and I love my town, so I guess I'm here to stay. So
there you go. There you go. So one of the topics we want to talk about today is something called dry eye, right?
Absolutely. So as this weather changes, you'll notice even with like your skin, it starts to get a lot drier because we have less moisture in the air. And so when that happens, we also throw in allergy season because, as the leaves are falling, there's more mold in the air and dirt, and we're all allergic to mold essentially. Sure. So a lot of patients will be coming in with dry, itchy eyes. And a lot of times it's not just the dry eye or just the allergies, but they kind of go hand in hand. But if we're not drinking enough water, that weather changes, the front surface of our eye will dry out quicker, and it can lead to blurry vision. Your eyes will feel scratchy and irritated, and sometimes they'll actually water. And everyone's like, no, my eyes are watering. They're not dry, Sarah. And I'm like, no, but they're dry. Mm-hmm. So I'm going to give you my little science lesson.
Okay, yeah, sure.
So our tears have 3 layers to them. They have a mucus layer that holds it up against the eye. Then you have this thick aqueous layer. That's like where we get our emotional tears. And then we have an outer oily layer. So when that outer oily layer breaks up, our eyes will water just like we're crying. So we've all maybe been in that situation. You walk out to the cold wind and it breaks up that oily layer, and then you start crying, but you're not crying. Your eyes are watering.
Right.
And you blink, and that encourages the oil to come out. And so sometimes all of that homeostatic balance gets out of whack. Mm-hmm. So with treating dry eye, there's no one-size-fits-all scenario. I wish, because it would make my job really easy.
Sure.
Each person's kind of different because there's the environmental causes. So then you try to fix it. Are you drinking enough? Do you need to add a humidifier in your house? If you have autoimmune things like arthritis and different things like that, it triggers the dry eye to be worse.
Really? I didn't know that.
Yeah. So if you have an autoimmune thing, you're fighting your own tissue in your body. So a lot of times with arthritis, you're fighting your joints. Well, it also, those inflammatory markers fight the tears.
Wow. Okay.
So then it breaks up the tear film, and sometimes you don't even create enough tears because of it. Mm-hmm. And so you're already miserable because your joints hurt, and now your eyes hurt. And so with that, you have to treat it more with like some steroids, or there's Restasis and some other anti-inflammatories that you can treat. If it's environmental, you can add, some of those artificial tears. And everyone always says, so what's your favorite artificial tear? And I'm like, any artificial tear, whatever the drug company gave you this week. The key with that truly is just picking one that does not say get the red out. That Visine, get the red out. It is bad for you.
Really? I didn't know that. Yeah.
So you can become very addicted to it. Well, your eyes will.
Is that why you see people all the time putting eye drops in Visine and stuff?
Yeah. So with the Visine, it's just like nose spray. It constricts the blood vessels, so then your eyes look nice and white.
Yeah.
But then they start to relax over time because of that drop. So if you're using it frequently, your eyes will look more red. So then you're having to use it more and more. And it doesn't actually treat the dry eye, the surface issue. It just treats the blood vessels.
Wow. See, I never knew that.
Yeah.
Okay. Yeah.
There is a new drop out, like 2 years ago it came out. It's called Lumify. That is a safe eye whitening eye drop to use.
Okay.
Because if your eyes are dry, they are going to get a little redder. I mean, if your skin is dry, it tends to be a little redder too.
Yeah.
So a lot of times interesting.
Yeah. I never knew. You always see the Visine commercials and stuff. It gets the red out, right? Yeah.
That little clear eye guy with the little thing.
Yeah.
So, Clear Eyes and Visine, they make a good artificial tear, but we steer clear of them just because it's overwhelming. If you go down the artificial teardrop aisle, you're like, whoa, there's so many. So it's truly just finding whichever one your eyes like best.
Sure. Awesome.
So
always see your doctor, if it's a problem, see you before or whatever.
Absolutely. You don't have to suffer with watery eyes and look like you're crying all the time. Or that there's always a way that we can treat it and help it get better.
All right. Where are you located at?
129 South Walnut, just up the street here.
Awesome. So so your dry eye problems, go see you, right?
Absolutely.
All right. Well, thank you so much.
Thank you.
Thank you. How's that?